Ever wondered why hyperlipidemia is such a prevalent medical condition in need of new treatments? Welcome to the intricate and important topic of hyperlipidemia, a condition that affects millions of individuals worldwide. Hyperlipidemia, in its simplest form, is a medical term for high levels of lipids or fats in the blood. This can include cholesterol and triglycerides, substances that, while necessary for the body's function, can lead to serious health complications when present in excess. You see, our bodies need a certain amount of these lipids to function properly, but when there's too much, they can start to build up in the artery walls. This buildup can narrow the arteries, slow down or even block the flow of blood, leading to cardiovascular diseases such as heart attack or stroke. Hence, the importance of managing and treating hyperlipidemia cannot be overstated. While there are currently treatments available, they're not without their limitations. Some people may not respond adequately to existing medications, others might experience side effects, and in certain cases, the drugs might not be potent enough to significantly reduce lipid levels. This highlights the need for new and improved treatments, a quest that is as urgent as it is complex. In this quest for more effective treatments, researchers and pharmaceutical companies are continuously exploring new pathways and mechanisms to reduce lipids in the blood. The goal is to find drugs that not only effectively lower lipid levels, but also have minimal side effects, a better safety profile, and ideally, provide additional benefits to our cardiovascular health. The journey of discovery and development in the world of anti-hyperlipidemic drugs is a fascinating one, filled with innovation and the promise of improved health outcomes. As we move forward, the hope is for these emerging treatments to significantly impact the management of hyperlipidemia and, by extension, help reduce the burden of cardiovascular diseases. With that said, let's delve into the fascinating world of new anti-hyperlipidemic drugs. Scene script. New anti-hyperlipidemic drugs. Sound complicated? Not anymore. Let's break it down, starting with their mechanism of action. These drugs are designed to lower the levels of lipids, or fats, in the blood. How do they do this? Well, some of them inhibit enzymes in the liver that are responsible for producing cholesterol, while others bind to bile acids, forcing the body to use up more cholesterol to replace the bile. Yet another group works by reducing the absorption of cholesterol from the food we eat. Together, they all contribute to lowering lipid levels. Now, onto absorption. This is how the drug gets from your digestive system into your bloodstream. These drugs are generally well absorbed from the gastrointestinal tract, meaning they get to work quickly. However, food can affect absorption, which is why some of these drugs are recommended to be taken on an empty stomach. Once in the blood, we move on to distribution. This is how the drug is transported throughout the body. These drugs are distributed widely, reaching the liver where they exert their effects. They bind to proteins in the blood, which helps them to be carried to their site of action. Next up, metabolism. This is how the body breaks down the drug. For these anti-hyperlipidemic drugs, the liver plays a key role. It metabolizes or breaks down these drugs into less active or inactive substances. This is an important step as it helps to reduce the risk of side effects. Finally, we have excretion, the process of removing the drug from the body. These drugs are typically excreted in bile and then eliminated through the feces. This process helps to ensure that the drug doesn't build up in your body, which could potentially lead to toxicity. Understanding these pharmacological aspects is essential, as it helps us to know how these drugs interact with the body to lower lipid levels. But remember, while these drugs can be very effective, they are not a magic bullet. They should be used as part of a comprehensive approach to managing high lipid levels, which also includes a healthy diet and regular exercise. So, let's recap. These new anti-hyperlipidemic drugs work by inhibiting the production, reducing the absorption, and increasing the excretion of cholesterol. They are well absorbed from the gut, widely distributed in the body, metabolized in the liver, and excreted in the feces. They can be a key part of the puzzle in managing hyperlipidemia, but they should be used in conjunction with lifestyle changes for the best results. Now, doesn't that make pharmacology a bit more approachable? Now that we've demystified the pharmacology, let's meet our new contenders in the fight against hyperlipidemia. First up, we have bempedoic acid. This is a first-in-class ATP citrate lyase inhibitor. It's designed to reduce the production of cholesterol in the liver. What makes it unique is that it specifically targets the liver, reducing the potential for muscle-related side effects. Quite a game changer, wouldn't you say? Next, we have the PCSK9 inhibitors. evolocumab and alirocumab. These are monoclonal antibodies that bind to a protein in the liver, reducing LDL cholesterol levels in the bloodstream. The beauty of these drugs is that they're more effective than statins at lowering LDL cholesterol, and they're also an excellent option for patients who can't tolerate statins. Then there's evinacumab, a fully human monoclonal antibody that targets angiopoietin-like 3 protein. It's been shown to significantly reduce LDL cholesterol in patients with homozygous familial hypercholesterolemia. Evinacumab is unique in that it works independently of LDL receptor pathways, making it an excellent choice for patients with this rare inherited form of high cholesterol. Finally, we have lomitapide and mipomersin, 2 drugs that work by reducing the amount of lipids in your body. They're particularly effective for patients with familial hypercholesterolemia who have not responded adequately to other treatments. What's impressive about these new drugs is that they offer greater efficacy, fewer side effects, and more treatment options for patients. While statins have been the mainstay of treatment for high cholesterol, these new drugs provide an alternative for those who can't take statins or need additional help lowering their cholesterol levels. Moreover, these drugs illustrate the innovation and progress in the field of pharmacology. They represent a shift towards more targeted, personalized treatments that consider the individual patient's needs and circumstances. And this, my friends, is the future of medicine. Impressive, aren't they? But how do they fare in the real world? Scene script. Here's what you need to remember about these new anti-hyperlipidemic drugs. Let's begin with their effectiveness. These novel pharmacological agents are making waves in the medical field due to their impressive lipid-lowering abilities. They work by specifically targeting and inhibiting key enzymes and receptors involved in lipid metabolism. This results in a reduction of harmful cholesterol levels and an increase in the beneficial high-density lipoprotein, or the so-called good cholesterol. Some of these drugs have been shown to reduce bad cholesterol levels by an astounding 50%, which is a significant step forward in the management of hyperlipidemia. Now, on to side effects. As with all medication, these new drugs come with their own set of potential side effects. These may include mild ones like headache, nausea, and muscle pain, to more serious ones such as liver damage and increased risk of diabetes. However, it's important to note that these side effects are relatively rare, and the benefits of these drugs often outweigh the risks. Moving on to drug interactions. These new anti-hyperlipidemic drugs can interact with other medications, altering their effectiveness or increasing the likelihood of side effects. For instance, combining them with certain blood thinners or antifungal drugs can lead to complications. That's why it's crucial for healthcare providers to be aware of all the medications a patient is taking before prescribing these new drugs. Finally, let's talk about their role in managing hyperlipidemia and improving patient outcomes. These drugs are a game changer. They offer an effective and targeted approach to reducing harmful cholesterol levels, thereby decreasing the risk of heart disease and stroke. This means that patients with hyperlipidemia can now look forward to a future with improved health and quality of life. With these new drugs, the future of hyperlipidemia treatment looks promising. So remember, while these drugs are a significant advancement, it's always important to combine them with a healthy lifestyle for optimal results. So let's continue to learn, grow, and strive for better health together. So, what does this mean for medical students and healthcare professionals? The understanding and application of new anti-hyperlipidemic drugs are not just about learning new names and mechanisms. It's a testament to the constant evolution of medicine, a field that never stands still. As aspiring doctors, nurses, pharmacists, or researchers, we're not merely passive recipients of this knowledge. We're active participants in a shared journey of discovery and improvement. The importance of staying updated with new treatments can't be overstated. It's what ensures we deliver the best possible care to our patients, informed by the latest scientific advances. But it's more than just a professional obligation. It's a passion, a curiosity, a dedication to lifelong learning and exploring. It's about pushing boundaries, challenging the status quo, and striving for the best. So, let's keep our minds open, our knowledge fresh, and our commitment unwavering. In the ever-evolving field of medicine, there's always something new on the horizon.